at this turnout, the efficacy seemed very almost equal. And if you look at the results, they're right on top of each other. So there's really no sacrificing efficacy for convenience. If the drug can be given by the patient, I think that's a big plus, because then you can take it anywhere. You don't have to be tied to a place. You can go on vacation and take it along. But the fact that it has that ACP administration requirement sort of damper things, but I think that's going to change in the future when these companies come up with a self-administration device. But I think it's, for convenience sake, it's much preferable to having to go somewhere for your IV infusion. So the ADAPT study was the IV formulation. And for the ADAPT SC study, we didn't have to go back and do everything over again. We just show that it does the same thing in terms of reducing IgG level. So the study basically divided patients into two groups, 1-to-1. One of them get treated with IV VYVGART, and the other one was subcue VYVGART. And then the endpoint was basically how well they reduced the IgG level. And the secondary measure was efficacy in terms of ADL and all that. So after the ADAPT SC study, they can go into open label where they get treatment again. And the next cycle can start no earlier than 28 days from the last dose of the previous cycle. And then, unlike previous trials, in this trial, the patients do not have to come back to their baseline level of ADL to get the next cycle, but rather by the investigator discretion, which is more of a in line with what would you do in the clinical setting. That is, you initiate the treatment when the patient feels like he or she needs it. So that's an advantage. And during the open label, we found that at least 6 cycles, the response to treatment remained the same. So there seems to be durability effect, and the adverse event did not increase. In fact, with the first cycle, the injection site reaction was in the low 30%, and by the 6th cycle, it went down to about 11.5%. So people get more tolerant of it over time.